This week we had a lot of trials for vaccines. Does it mean that we will eventually get a vaccine, or could the antibodies just not be sustained?
Yeah, well, good morning. We're certainly hopeful with the news out of Oxford. Yet another vaccine that is showing the production of antibodies. This study had over 1,000 participants. 2 doses seemed to do better than a single dose in producing antibodies. The investigators report similar to that of people who've recovered from the virus, so that's another good sign. So we now have a couple of vaccine candidates that are showing us similar results. Those results that they do produce antibodies after 1 or 2 doses, and that's a good thing. So it's all promising. But again, they are in healthy volunteers. That's a far leap from preventing coronavirus infection.
Jason, are we better at treating the sick with COVID-19? Is there a better chance of survival now than there was 2 months ago?
So the answer is somewhat it depends. Yes, we know a couple of drug candidates both reduce time in length of stay and symptoms. That's the remdesivir medication. We know that for oxygenated and mechanically ventilated patients, we have improvements with the drug dexamethasone. So that's another improvement, but those are modest types of improvements. And we've recently seen details about inhaled medications, inhaled interferon, potentially helping to reduce patients. Now, that last study, I'm not being more specific because it's not peer-reviewed yet. It's also very small sample size, and so the jury is still out on whether or not we can trust those findings in that study for the inhaled interferon medication. But we are seeing small gains in a variety of different therapeutic options, which help to improve overall survival.
Jason, when you look at some of the numbers out there and have we been able to treat, are you expecting a strong second wave as we get onto the colder months? And would this be tied also to people starting to travel again because of summer, but also schools reopening?
Yeah, so I think it's really important for us to realize that in the United States, at least, I'm not convinced epidemiologically that we've ever left the first wave. So do I see even a worsening of this first wave? I think the case is true. You know, in the beginning of the pandemic, we were all having conversations about, the summer will result in decreased numbers of cases, right? And most of us in our fields were saying, well, there's nothing specifically about summer that reduces virus. It's about our behavior. Well, our behaviors haven't really shifted that much. And so if we look at things that put our behavior in greater contact going into the fall, such as schools reopening, such as going back to work, such as reduced social distancing measures like restaurants reopening, all of those are opportunities to continue to spread and increase new cases of the virus. So it's really centered on how we respond behaviorally.
But children, as far as we understand, are actually less affected by COVID-19. Does it mean that they also transmit it less?
So no, and there's continued emerging data that our age of new cases are shifting into younger people, particularly those adolescents into young adults, and we are seeing some severe cases among that age group. So we can't, I want to make sure everyone recognizes that there's no such thing as a safe age in terms of COVID-19. But further, when we think about putting kids back in schools, we really need to think about, is that our best decision? Of course, there's economic impacts of not doing so. There's parental stress and family stress by not doing so. But schools are not designed to help provide social distancing. They're not designed to help kids who touch everything, including themselves and their face and each other, to prevent doing so. So we really need to think long and hard about best practices that other countries have implemented who have sent their children back to school and done so successfully. But we also really need to be thinking about how parents are engaged and involved in making this decision. Parents really need to understand what their school system is doing.